I am Yahya Shehabi. I'm one of the intensive care consultants, and I'm going to demonstrate how to do a CAM-ICU. This patient has been admitted 5 days ago with necrotizing pancreatitis and has been ventilated since then. One of the first things we do to do a CAM-ICU is to see what the current RASS score is. At the moment, this patient has a RASS of 0. She is calm, she opens her eyes, and she makes eye contact for more than 10 seconds. She obeys commands in all limbs and very cooperative. So once we establish that the current RASS is 0, then she's qualified for a CAM-ICU assessment. We look at the RASS scores in the last 24 hours and before, and if the RASS score is wandering around the baseline, that's the feature 1 of the CAM-ICU, which is essentially an altered mental state. So a wandering RASS that goes between -1 to 0 to -2 to +1, that means that there's an alteration in the mental state. That's feature 1, is a very important part of the CAM-ICU and delirium assessment. We did look at her RASS scores over the last 24 hours, and her RASS was wandering between -2 to -1 to 0 to +1. So she had an alteration in her mental state over the last 24 hours. So she has satisfied feature 1. Once we've done that, we go on to do feature 2. Feature 2, which is the inattention. Feature 2 essentially is the cardinal sign of delirium. Patients cannot be delirious if they are attentive. So we test their attention when they are intubated by asking them to do a task, and in this case is to squeeze my hand. So the first thing I'll do, I'll teach the patient to squeeze my hand just as a command, and then ask her to squeeze my hands to the letter A. Okay, hello, can you please squeeze my hand there? That's good. So now she's squeezing my arm to voice. Can you squeeze my hand if I say the letter A? A? Good. So then now she squeezed to the letter A. And then I will tell her to squeeze when I say few letters with A and without A, using the standard phrase, which is save a heart. Now I'm going to say a few letters. I want you to only squeeze to the letter A, okay? I'm going to start now, all right? S, A, V, E, A, H, A, R, and T. Thank you. So you can see that patients who are attentive, they will squeeze to the letter A and not squeeze to any other letters. Patients who are delirious, they usually squeeze to every letter, or they may not squeeze at all. Once we do the attention, and if the attention was positive, then we go on to do the next test for the delirium, which is if the attention is positive, which means that she is not inattentive, then we look at the current RASS. If her RASS is equal 0, then we will need to do the 4 questions. If the RASS is 0, if the RASS is other than 0, then she is already delirious. Okay? In this case, this patient is definitely CAM-ICU negative because she is fully attentive. The 4 questions that we need to ask if they are inattentive but have a RASS of 0 is we ask them 4 questions, which are simple questions. Patients can answer them by nodding their head. So the first question is, does fish live in the sea? Which is common, so they will say yes or no. Do we use a hammer to hit a nail? Yes or no. Does 1 kilogram weigh more than 2 kilograms? again, yes or no. And the final question that we asked them is, does a stone float in water? Or does a rock float in water? And that's a yes or no. Now with the CAM-ICU, for the attention test, they're allowed to make two mistakes. And for the disorganized thinking, which is the question that we just asked them, they are allowed to miss one question. Thank you.